Interest. I am Malika Ramsey. Thank you very much for joining us again this week. This week, of course, with me is leader of the People's National Congress Reform and leader of the opposition, Brigadier the Honorable David Granger. Glad to have you again, sir.
Thank you very much, Malika.
This week, the Brigadier and I will be discussing nursing in Guyana and a partnership for national unity, and of course, along with Brigadier David Granger, believe that nursing is not in the place that it should be. First off, Mr. Granger, what impact, because you've already established that nursing is not where you want it to be, where it should be in terms of giving efficient service, but what do you believe would be the impact on general patient care if this problem is not fixed soon?
Thank you for the question, Malika. It is a fact that most Guyanese, if not all of them, are born into the hands of nurses, and presumably when you're about to die, the last person to deal, or maybe the last person to deal with you, will probably be a nurse. So it's a question of cradle to the grave, that we all trust and depend on nurses from the time you're born, literally to the time you die. So if a nurse is not properly trained, properly equipped, properly motivated, there are going to be problems for a large number of Guyanese citizens. So we were deeply concerned in a partnership for national unity about the conditions under which nurses are trained and the reasons why they leave the profession in such large numbers. And I don't blame the nurses for the errors which occur in the hospital system. I blame the training system, and we have to look at what happens at training to find out why there are errors taking place or occurring in hospitals. And there are errors. There are errors of high child mortality. There are errors of mismanagement. Sometimes people complain about the attitude of nurses. And we have to find out what's going on. And that has helped to make the nurses more efficient and ensure that there's better patient care. Ultimately, we want to see a high quality patient care.
Sir, what would be the first issue within the training of nurses that that should be addressed so that we could have that high quality of patient care?
Eventually, or essentially, elementally, you have to look at the type of person who is selected for training. And there has been indiscipline. There have been cases in which the student nurses themselves have not shown the quality or the standard of behavior which we expect of nurses. We all expect nurses to be angelic, people who save you from pain and disease. But sometimes nurses are recruited as young as 16 years old. Some of them might be immature. Some of them are guilty of absenteeism. They stay away from classes. They get a small stipend, and that seems to be the main attraction for some of them. But I think we must look first at the selection procedure to make sure the best quality persons are selected for nursing. And of course, when they are selected, we have to pay them properly. But the big problem is the character and the quality of nurses we select. But in addition to that, there are several other problems. I think mainly there is a problem of, I suppose, overcrowding, because there are far too many nurses being recruited in relation to the facilities for training. And I understand what might have been happening. A lot of doctors are coming back from Cuba, a lot of health centers are being opened. So there has been a rush to recruit as many trainee nurses as possible. But the result is you recruit them in droves, they've been leaving in droves, because you recruit 300 and only 150 finish the course. So the policy that is being followed by the People's Progressive Party Civic Administration is self-defeating, because the facilities cannot sustain such a large number, and many people will leave anyway. And we have to look to get a smaller number of committed people, pay them well, make sure that the quality of instruction is high, and that they remain and become qualified state registered nurses.
Do you believe, because you did talk about the overcrowding, if we're to build one or two other facilities, probably in Georgetown and other parts of the country, do you believe that would help to solve the problem? Because it's a case where people may be passionate about going into healthcare and becoming nurses. You can't necessarily stop them, or you shouldn't, from doing that. So how do you really solve the problem? Can we build other facilities?
Well, the infrastructure problem is important because there have been reports in the past, but everything in the past, of course, I don't know whether these problems still recur, of the infrastructure in the Georgetown School of Nursing being overburdened because of the large number of student nurses. Toilets don't function, the place is poorly ventilated, there's inadequate furniture, and as a result of that, there have been cases where student nurses have been standing up in the corridors, not enough seating accommodation. So we need to look at maybe providing a new type of facility. I believe that building originally started off as a dwelling place. It was somebody's house, and they kept expanding, and then I think they acquired an annex. But it was never conceived as maybe you would conceive of a university campus or a new school with classrooms, toilet facilities, staff rooms and recreation areas. It was just an old house, and it has sort of outlived its usefulness. You need a purpose-built national nursing school, just like you have a Cyril Potter College of Education. You probably need a College of Nursing, a School of Nursing, so that people can get out of this congested place in Cummingsburg, Georgetown, and go to a place where they can do their professional training in comfort. So I believe the infrastructure problem is very important. And in addition to infrastructure, you need proper training aids. Nowadays, people don't want blackboards, they don't want chalk and talk. They want to see visual images, audio, visual equipment has to be provided. They want to get computers, and you have to use modern techniques to grasp the imagination and the attention of students. I don't believe this has been happening. It's been run on a shoestring. Although the Minister of Health a few years ago, I don't know what's the current price, said about $600 million are being spent on nurse training, some of it is apparently not being well spent, some of it's probably being wasted.
Brigadier, before I come back to the minister and the ministry's role, you did say earlier, and of course I've read that some of the nurses who are properly trained, they eventually leave. They migrate and they go to what people call greener pastures to carry on their profession. How do we keep those properly trained nurses here so they can train the younger ones coming up? Because we did talk about problems of indiscipline and absenteeism. How do we keep those trained nurses here?
Well, there have been several studies about this, because a very large number, in comparative terms, compared with even Jamaica, Belize, Barbados, a very large number of trained nurses leave. I could only assume that there are certain push factors, and one push factor is certainly the level of pay, and I think that is something to be corrected. And sometimes nurses have to work long hours. They do the type of work other people may not want to do, particularly with patients who are incapable of helping themselves. So we need to look at the terms and conditions of service, because these are qualified people. They spend 3 years in training, and you would expect that graduates from that course would be pretty well remunerated, and they'd be committed to staying here for a longer time. But not only do we lose a lot of candidates, nurse candidates, about half, according to the recent reports, but even those who qualify, we're losing a considerable number through migration. So I think you have to look internally, and that is why a Partnership for National Unity is not just complaining or belly aching about nursing school. We're looking for a re-evaluation or re-examination of the entire training apparatus, the syllabus, the tutors, the equipment, so that we can give nurses quality training. And I would like to believe that at the end of that process, we will get people who are prepared to stay and work hard. Let me tell you a personal story. Many years ago, when my wife was pregnant, she insisted on going to the Georgetown Hospital to deliver her children. the standard of nursing was so high. She wouldn't go to a private hospital. She insisted on going to the Georgetown Hospital because the registered nurses were such, they were so reliable. They were very kind, and of course I was there myself, so I could testify to that. But things have changed.
Yes, because now people who can afford it are trying to avoid it, avoid the Georgetown Hospital and the nurses here, unfortunately. Now, I can recall in 2012, during, of course, this is 2014, during the budget debate, APNU Member of Parliament, one of your own members, Dr. George Norton, had highlighted some of these problems that we were having with the nursing school during the budget debate. And it was greatly carried by the media. You even had cases where the Nurses Association got involved, saying that we're calling our nurses in these health centers as actually weapons of mass destruction. This is 2 years after. Why do you believe that nothing seems to have changed with the research that we've done so far?
Well, it seems like an exaggeration, but I could understand how the Nurses Association felt to use such a strong expression, weapons of mass destruction. But they meant that, I would like to think that they meant that inadequately or insufficiently trained nurses are likely to do more harm than good. And a big problem that both Dr. Norton and the Nursing Association were concerned about was the ratio of trained tutors to students. That's very, very important, because nursing is not a textbook science alone. It has a major practical component. In addition to practical, it's not just practical and theory on one side. There's also the caring aspect, the emotional. These people have to care for the patient. And I think they were concerned about the inadequate number of tutors. I don't know what the problem is, whether tutors were being retired too early, but it is quite clear that a large number of part-time tutors have to be retained. And maybe the ministry which runs these three schools, one at Amsterdam, one at Georgetown, and one in Linden, the ministry needs to look at having a larger number of full-time tutors who could pay attention to maybe smaller classes to ensure that there is good quality.
APNU is basically calling for an investigation into not only the nursing school but nurses in general. What role can you play, or do you intend to play? Because, and at the same time, I'm wondering too if you're not concerned that this may be seen as just another call by a Partnership for National Unity.
Well, it's not just another call, because the World Bank has written, USAID has written, PAHO has written, and we can rely on reports over the last 5 years from these organizations which examine in some detail. I mean, there are some aspects they didn't deal with as deeply as we're dealing with it now, but certainly there has been evidence that there are tremendous push factors in the nursing profession. And I would like to feel that APNU's call, added to what has happened over the last 5 years, the report which we've gotten from PAHO, WHO, USAID, and the World Bank, would show the Ministry of Health, would show the People's Progressive Party Civic Administration that something drastic needs to be done. There's a state of emergency in nursing, and we don't blame the nurses, we blame the system, we blame poor management, poor training, and poor facilities provided for the nurses. Guyanese are entitled to a higher level of patient care, and they can only get that patient care if we solve the problems in the nursing profession.
In the final moments of this broadcast, sir, again, we're anticipating the reading of the 2014 budget. What, apart from calling for the investigation, what would you urge the Ministry of Health, more so the health minister himself, to do to allocate in terms of monies for the development and the improvement and the professionalism of the nursing school?
Over the last 5 years, we have called attention to the most important aspects of nurse training which need attention. And we are concerned with things like overcrowding, congestion, infrastructure, indiscipline, and we would like the Ministry of Health to pay attention to the existing problems first. Let's deal with those problems, then we could deal with the long-term problems of migration. I am confident that if we solve those existing problems now, we'll get a better quality nurse, and the nurse will stay in Guyana.
Thank you very much. Leader of the People's National Congress Reform and Leader of the Opposition, Brigadier the Honorable David Granger. This has been another edition of the Public Interest, and we were discussing the unfortunate state of the nurses, of our nurses, and the nursing school in Guyana. Join us again next time. I am Malika Ramsey. Goodbye.